Hi everyone, we are from group 9. So we will tell you about the exercise stress test. So first, what does it mean? So this test may be ordered to measure the exercise capacity, to diagnose the exercise related symptoms and to assess the treatment. It also a useful tool for detect the coronary artery disease and for evaluate the medical therapy and cardiac rehabilitation. So, this exercise stress test will involve a person that will walking on a treadmill or pedals a stationary bicycle in the presence of a doctor or a technician. And this test will monitor the electrical activity, the breathing rate, the heart rate, and the blood pressure. What can the result tell you? So, there is some item that we can interpret from the results, such as the basic ECG interpretation, the symptoms, the reason for ending the exercise, the blood pressure response, the presence and frequency of the arrhythmia, the ECG changes observed during the test. So, all of the result that we get will be in the form of positive result, negative result, equivocal, uninterpretable, maximal or submaximal. So first we go to the positive results. Positive result will show you the ECG finding that may suggest a myocardial ischemia. All of this is the example of a graph that show you a positive results. So, clinical findings suggest test positive for ischemia usually involve exercise-induced hypotension, exercise-induced angina, appearance of an S3, S4 or heart murmur during the exercise. So, for the negative test result, it's usually the ECG changes that may occur during the exercise stress test is the shortening of the QT interval or the peaking of the T wave and P wave, and the shortening of the PR interval, so it involves of the QT-PR. And then the clinical finding found that the incremental increase in blood pressure and heart rate, fatigue, dyspnea, flushing will give you a negative result. So next is the equivocal. Equivocal happen when there is alteration in the P wave and the T wave. So this equivocal only involve a P wave and the T wave, not like others. So it will also happen if there is a changes in atrioventricular conduction, and if there is a appearance of a premature arterial or ventricular contraction, but it is not specific indicator for the CAD. And for the uninterpretable, usually because of the patient or operator inability to complete the test, so further diagnostic studies should be planned. And for the maximal and submaximal, maximal involve if the test we achieve the target, such as the target of the heart rate, the exercise level, and the time limit. But so for the submaximal, we do not achieve the target or the expected goal. So where will the doctor order for this exercise stress test? Usually if the doctor want to diagnose the coronary artery disease and the possible heart-related cause of symptom, to determine the safe level of the exercise, to check the effectiveness of the procedure done to improve the coronary artery circulation, to predict the risk of the dangerous heart-related condition, and to identify the heart rhythm changes, and to learn how the heart medication that have given to the patient are working, and to help to develop a safe exercise program. So that's all from us. Thank you.